Recently, a meme was disseminated in multiple social media threads that referenced a woman who decided to have an abortion because her physio told her she was weak. I won't post any links to the meme here because I think it detracts from more enveloping issues. Predictably, the meme generated some heated discussion, sometimes to the point that threads were deleted by the admins of the group. Most of these threads were internal conversations among physios that neglected to identify the greatest sources of preventable harm to suffering patients. While I don't want to focus too much on the meme itself, the suggestion that poorly worded messages about low back pain are associated with abortions isn't particularly illuminating. In many cases, people who posted the meme criticize commentators for not reading the full text of the associated article and for taking the meme out of context. Well, then don't post the meme and instead just post the article. Given the choice between a meme and a complete article, most people, myself included, are going to take the path of least resistance. If appreciating the broader context was the goal here, posting an abortion meme was irresponsible clickbait. The meme depicts an extreme example of clinician-induced psychological fragility, not the typical harm perpetuated by poorly constructed messages about pain and anatomical structures. It actually undermines the message that effective communication is so important, because effective communication is just good medicine, even when the consequences aren't so dire. Effective communication is important even in cases of less consequential harm. Healthcare professionals shouldn't need scare tactics to deter them from perpetuating mistruths about pain and the body's adaptability. Physios in particular need to be above this practice if they are to be truly respected by other autonomous providers and by the public. In defense of the meme, some commentators contended that while the abortion example may be atypical, things like unnecessary surgeries and opiate prescription are more common harmful practices that result from ineffective communication. Opiate abuse and unnecessary surgeries are issues that need to be addressed, but they are not caused by nocivic messages or thought viruses. That language is important as a rhetorical statement, one I hope we can all agree upon. We shouldn't tell people that their spines are crumbling or that their discs have exploded. However, and I think this point gets lost in conversations about language, actions are more harmful than words. Chronic pain patients don't give themselves abortions, fuse their own spines, or prescribe opiates to themselves. While communication skills are a component of clinical competence, overall competence and judgment are the real issue. Like, do back surgeons just perform a spinal fusion just because a patient walks into the room saying, "I want to have a fusion because my PT says I'm weak, vulnerable, and unstable"? The buck ultimately stops with providers who can perform surgeries and abortions and prescribe opiates. Psychological fragility, even that which is physical therapy induced, shouldn't be a criteria for back surgeries or opiate prescription. It's great that PTs are having these conversations internally. Shouldn't they, or we I suppose, be reaching out across other disciplines to ensure that the message is heard by professionals whose scope of practice necessarily positions them to cause the most preventable harm? PTs aren't the only nocebo offenders. This is not a knock on physicians. They just generally assume greater responsibility and, in turn, greater potential for harm than PTs. What words we use with patients is not a trivial matter. However, PTs sometimes overemphasize the influence of language because their mouths can be their most dangerous tool from a scope of practice standpoint. No profession has a monopoly on good or bad ideas. Discussions within physio circles criticizing the number of surgeries performed or opiates prescribed are less impactful in such a vacuum. They do little to advance healthcare or to advocate for the patient. Hopefully, physicians are as critical of themselves as physios are of everybody else, including other physios. It would be even better if there were more multidisciplinary patient advocacy groups and not just professional groups driven by politics and market share. The boundaries between many health professions are arbitrary. Exaggerating the concreteness of these barriers, while self-serving from a branding standpoint, underserves the patient. We all need to be better.